Hello everyone, my name is Hazel Evalie, and in this presentation, I will present a plan for stakeholder education about my evidence-based practice project, which will entail looking into the potential of the use of melatonin supplements compared to sedative hypnotics in the reduction of incidence of insomnia among elderly patients within 3 months. In this presentation, I will discuss the stakeholder groups and their role in the project implementation. I will also identify their educational needs, consider the theoretical foundation and conceptual framework underlying the proposed intervention, and conclude by including a plan of delivering the intervention. Sleep disorders are common problems of older adults and usually remain underdiagnosed. More than 50% of older adults have at least one chronic sleep problem, according to Koyanagi et al. In the United States, 35.2% of adult population experiences short sleep duration of less than 7 hours, according to Chong et al. In primary care settings, commonly encountered chronic sleep problems are insomnia and excessive daytime sleepiness. Poor sleep in older population is associated with adverse effects that include reduced memory, impaired concentration, inhibited functional performance, and decreased quality of life. Others include chronic fatigue and increased risk of cognitive decline, malaise, accidents, falls, and mortality, according to Montgomery et al. Poor sleep is also associated with increasing healthcare burden. As of 2016, the aggregate cost of insomnia in the United States of America exceeded $100 billion annually, according to Wickwire et al. Most of the people who use prescription sleep aids in the United States are age 80 and above, followed by those aged 50 to 59 years. Numerous non-pharmacologic and pharmacologic interventions are available for the management of insomnia, but the majority of pharmacologic interventions available to manage insomnia in the elderly population are associated with severe side effects. With the increasing prevalence of insomnia among the elderly, timely treatment is needed. However, the different medications used to treat insomnia have different efficacy and complications. As a result, this has informed my project, which will be guided by the PICO question: in the elderly patients suffering from insomnia, would the use of melatonin supplements compared to sedative hypnotics reduce the incidence of insomnia within 3 months? The stakeholder education plan aims to get potential stakeholders in the clinical or administrative field behind an agenda for evidence-based practice. The healthcare sector requires appropriate reconstructing to improve value for patients' care, access, and convenience. Several stakeholders will be involved in this project and will include a nursing informatics officer, the healthcare facility administrator, a physician, and advanced practice nurses working in my clinical setting. The administrator in the healthcare facility will oversee the entire cost of the project and facilitates its implementation through procurement of materials and equipment and scheduling of the patient to receive intervention. The nursing informatics officer will be involved in gathering and management of any data about the project, providing feedback and documentation. The physician and advanced practice nurse roles will include the implementation of the project, assessment of the participants, risk assessments, providing feedback, and help in the determination of the most effective interventions. Educational needs for the administrator will include goals of the project, cost analysis, and project management. The administrator will need to be educated about objectives of the project to facilitate the proper implementation of the project. The educational needs for the physician and advanced practice nurses will entail undertaking the purpose of the project, risk assessment and determination, and the application of evidence-based screening tools, as they will be directly involved in the implementation of the proposed intervention by administering the supplement and the pharmacological products to the two participating groups. The educational needs for the nursing informatics officer will include the purpose of the project, electronic data management, and documentation. The general systems theory will guide the project, It explains how to break full things into pieces and then study the way pieces work together in systems. The choice of the theory is because it provides a holistic method to study a nursing problem as an open system and liberates one's thinking from the pieces versus whole dilemma. The 7 steps model, guided by the decision-making model, will guide my CSP intervention. The model entails 7 steps that include establishing the goals and objectives, classifying and prioritizing the objectives set in the first step, developing alternative actions, and evaluating alternatives against objectives. The model's 5th step involves assuming a tentative decision to most appropriate option, then assessing the tentative decision for more consequences, and finally taking decisive action and extra actions to avert the consequences. The choice of the model is because the analytical tool provides useful insights into the implementing and evaluating of a solution to a problem. The planning phase entailed assessing the need for the project by developing the PICO questionnaire statement and conduction of an extensive literature review whose scope covered the use of mobile and smartphone technology in the management of insomnia and pharmacological and non-pharmacological interventions, and synthesizing the information. The second phase involved the developing of implementation plan that entailed identifying the project goals, stakeholder groups, the project needs, a mind map, and likely outcomes. This step also involved education and training of the stakeholders groups. During the evaluation stage, the stakeholders' knowledge gaps were determined by administering a pre-evaluation survey, and implementation plan was piloted to identify the areas that needed improvement. During the implementation of the project, the stakeholders will be updated about the status of the project through meetings that will take place twice monthly, and they will be welcome to give feedback to the improvement of the project. Thank you for your time. My references are attached to this video.